Yeah. So the basic idea of theory of change is that it's the blueprint or business model of a nonprofit organization, right? So it's basically it becomes even more important than a business model in a real for-profit organization because there's less feedback loops in a nonprofit organization. Right? So if a business has a business model, they start up a business, and if it doesn't do well, they'll very soon see they're losing money and the business will shut down. That doesn't always happen in a nonprofit organization, right? If anyone's not muted, they just the host just mute them, please. Um, it doesn't always happen in a nonprofit organization, right? So you'll have organizations for years collecting funds, whether it's zakah funds, sadaqah funds, and we don't necessarily know very easily whether they're actually uh, doing good in a very effective way and making profit in a sense of impact, right? And that's why I truly believe that all nonprofit organizations every year should evaluate whether they should still exist, right? Are they is there maybe another organization that can use their resources, the zakat collecting, and do a better job with it, for example? Or are they in a space that's neglected? Are they doing something no one else is doing? Or if they're not doing something that no one else is doing, yeah, like I said, can someone else do it better? And just evaluate things like that. So that's why it's so important to have a business model to see, okay, as a nonprofit, whether you're doing research, uh, advocacy, or charity, what is your business model in a sense? What is your theory of change? So theory of change is really this a set of logical steps, right, to try and figure out if you're having an impact, if you're achieving your goal. So just two memes to illustrate this. You'll see the first one where these people decided to build a bridge to cross the ocean. Um, and they probably were very well intentioned. Um, and as somewhat, as long as you're doing a little bit of good, maybe we're making an impact. But maybe if they build a model beforehand, they realize maybe they should just use the boat instead, right? Maybe a bridge wasn't the best tool for this job. Or you have this mathematical proof on the right-hand side where it's missing a key middle step of how actually it's supposed to have an impact. So that's essentially what theory of change is. How do you go from your inputs to your goal? So it can boil down to a question. How do I expect results to be achieved? If these inputs that I'm doing and activities produce certain outputs, this should lead to certain outcomes which ultimately contribute to my goal. So the inputs activities is what you actually do, right? So whether it's packing food parcels, spreading awareness on social media, that's activities. The outputs would be the effect of that input, right? The tangible effect. So people receive the food parcel, they eat the food parcel, right? That's your tangible effect. What is your outcome from that? That's something where this is what we're actually interested in, right? So we've got our sphere of interest. Your intermediate outcome might be, okay, well, we alleviate hunger, right? So it's not so much about food parcel, but to alleviate hunger. And then your final goal is that people live better lives, healthier lives, lives free from less stress, free from stress. Um, so impact is your actual goal, and that's what you're really trying to make an impact on. So yeah, here are some examples. So for a research organization, your input will be doing the research. Uh, what your output will be published research reports. But that's not actually what you're interested in. What you're actually interested in is people using your research then to make better decisions, which will then actually affect the thing you want to affect, right? So this is your logical steps. And the value of this really becomes it makes it easier to evaluate and improve your interventions, right? So you can actually assess, okay, once you've laid out your steps for everyone to see, it can be questioned and critiqued and improved on. Okay, does this actually the scores of events, does it seem logical? All right, is it tight? And if you look at before I look at the others, if you look at the picture, what we're often very good at is avoiding implementation failures, but it's the theory failures where we struggle. So we'll look, okay, how many food parcels did we distribute? How many people got food parcels? How many people benefited from food parcels? But what we really want to emphasize is this part here, avoiding theory failures as well. So those outputs and those inputs, were they the best inputs and outputs to achieve the actual outcomes, what we're actually interested in, to achieve the actual goal? So with this, you can kind of see this model allows you to test those assumptions, right? Because you lay it all out. And you can see there's any key aspects that your project depends on. So just to give an example to illustrate this concept. This is one project done by the Jameel Abdul Latif Poverty Action Lab in India. And they wanted to increase child immunization. That was their goal, right? Ideally, that shouldn't be the goal. The goal should be something more abstract, like improving healthcare or preventing more death. And this would be an outcome or goal, but they're taking this as a goal. So increasing child immunization. So they first do a needs assessment, and this is very important. Like you do your research of the context, figure out, okay, what are the needs, what are the problems? So every year in India, between 2 and 3 million people die from vaccine-preventable diseases. And only 54% of 1 to 2-year-olds receive the basic package of immunizations. That's when kids are most vulnerable to diseases. The problem is that in India, immunizations are actually offered for free, but still immunization rate remains low. So in, for example, rural Rajasthan, this is below that, below 22%. So this is your problem. Now we're going to figure out, okay, how do we solve this? There are a couple of approaches one can take. So there are possibly some supply side problems, right? So the average household is within 2 kilometers of the nearest clinic. So maybe a solution is to have more clinics. Or there's a lot of absenteeism at the government facilities. So 45% of workers are absent on any given day. So maybe improving that might be the solution. But then also on the demand side, there are potential interventions. There might be cultural, there is some cultural resistance, distrust in public health institutions. Or people don't value immunizations because it's a kind of a short-term cost for a long-term gain. And the cost, even though immunizations are for free, to travel to the centers cost a lot of money, and you're thinking of more of a long-term benefit, right? So in areas of high poverty, that isn't necessarily a trade-off you can make. And then sometimes limited income, parents can't afford to take a day off from work to go take their children for immunizations. That's potential. So what are some solutions? So I've mentioned some of the problems. This intervention decided, okay, let's test 2 interventions. One, more regular camps, and another, giving people incentives. Right, and incentives in this intervention take place either in terms of cash or a food parcel like a lentil package. So this is where we would often stop, right? We'd say, okay, we want to increase immunization. We have this input and this goal. But we need to map out now. This is where the theory of change comes. How exactly will this input get to our ultimate goal? And will it really? Are there some assumptions we're taking for granted? So this is your first model, right? So we mentioned the input, output, and outcome, and your goal. So the theory here, and again, this theory will need to be tested, is that if you increase resources for immunization camps will be kept reliably open. If you have incentives for immunization, those incentives will be delivered. So that's either cash or lentils. The outcome is what you're hoping will happen, is that parents will then bring their children to camps. And then they'll continue bringing their children to camps. And then you'll have full immunization. The next thing, however, is you need to think about your assumptions. And a very important thing of building a theory of change is to map out your assumptions very clearly. Things we might take for granted and things we might need to measure. So just because camps are kept reliably open, it doesn't necessarily mean parents will bring their children to camps, because you might be making an assumption that parents trust the camps. And just because incentives are delivered, we're also making an assumption that parents value those incentives, right? So we might be giving the wrong incentive. And that just because parents will bring their children to camps, once, it doesn't mean they'll always bring them. So, and the structure will be sustainable. So often it's very easy to put a once-off intervention, but to ensure that structure is sustainable, is an additional thing we need to account for. So that you've got your objectives, right? Now this is drawn up in a different way. Is that if you look on your leftmost column, you have your inputs, outputs, outcome, and impact. And on your rightmost column, which we've touched on, is some of your assumptions. And ideally, you want those inputs to lead to that impact. However, once we have our assumptions, then we can start thinking about, okay, what are potential indicators? How do we know if this is actually working, right? Because often, right, we can measure our inputs, like how many hampers did we deliver? But that's just the measurement indicator of, for example, the first step of the process. We want measurements for every step to ensure that the theory of change is actually working. Then there might be your sources of verification. How do you actually measure what you want to measure, right? So if it's a food parcels, we can count how many food parcels. That's a measurement. So here you see, for example, they'll have random audits on camps to make sure that the camps are established. You can have to see if parents attend immunization camps repeatedly, you can have household surveys. So it's very important when you build a theory of change to, once you identify your assumptions, then is to actually test out those assumptions. Right. So you'll see we've been doing this also through our ASRI Civic leadership program, in that one, we made an assumption, for example, that breakout rooms will be beneficial, or that the content we're choosing will be beneficial. But we want to actually measure that, right? So every week we send out a survey, for example. In a couple of weeks after we finish quite a few breakout rooms, we'll be measuring something later down the line. Did these breakout rooms actually lead to connections, right? Because we're going to measure something further down the line. That was our actual goal, not just that breakout rooms are beneficial for that moment, but that it leads to something long term. And at the end of this leadership program, we'll also be measuring, okay, did any projects come out of this, right? Did multiple projects come out? Because it's not just we don't just want this to be intellectual entertainment. We were thinking about, okay, what's our actual end goal of a leadership program? Well, to start leadership project or active citizen and see tangible active citizenship coming out of the program. So that's why we were thinking also in the lines of a theory of change, in terms of how do we measure if a leadership program like this is actually successful after we've made our assumptions. So this was the results of this specific example, right? So, and it shows kind of the value of a theory of change and of measurement. So in the control case, right, in all of these cases, you invest the same amount of money into these immunization centers. In the control case, which is your normal case, the immunization rate is 6%. So you'll generally have one village that will be a control group, and you'll have another with one intervention and another with another intervention. Those who've done medicine and some of the health sciences will understand this idea of randomized control trials. If you just add more camps or more resources to camps, it jumps up to 17%. But if you have a camps plus an incentive, in this case, lentil, jumps up to 38%, more than double. And the cost of each immunized child. So you could spend a lot of money on immunization camps. And that would be an understandable, theory that, this would actually lead to more immunization. But you could actually spend less than half of that. But if a portion of that, instead of going towards camp resources and opening up more camps, you gave an incentive, like lentils, for example. And this goes to show that in the context, it's a theory that, because this was initially based on the theory that, parents can't afford to take a day off work. And then it's often far. They're not in a situation where they can easily just take a day off work to go vaccinate their child, or they have to take care of more short-term concerns in favor of long-term. And that's not always a trade-off you're able to make. But again, at that point, it was just a theory. Now the data kind of validates that theory, that actually does assist with immunization, which then will lead to, better healthcare and longer lifespans. So some general guidelines for a theory of change is to, number one, invest sufficiently in understanding the context of the problem beyond anecdote, right? So often, this happens with all of us, right? There's this one study on unconditional cash transfers. Often we hear that, we shouldn't, give poor people money. We should give them food or something like that. And the argument is that, well, they'll go spend it on drugs. or alcohol. And this is actually a global assumption, right? Everyone has, and it's not completely false. It's based on some anecdotal examples, like maybe personal experiences. But when looking at the data, we find that at scale, this often is not the case. And then most people do not spend it on drugs. They spend it on things they really need. Right. So when I say invest sufficient understanding the context of the problem, understanding the scale beyond just anecdote, things we've heard. And cash transfers, like for example, as this example, has over 300, studies. It's one of the most well-researched interventions. Most of them showing that, it's arguably one of the most effective interventions. But just to drive this point home, that beyond anecdote. Mapping the causal pathway backwards, right? So often we'll think of, okay, we want to do this, uh, and how will this thing we're doing, like food parcels, for example, lead to this goal of poverty alleviation? But sometimes it's better to think, okay, we want to alleviate poverty. Okay, if we need to alleviate poverty, what are some intermediate outcomes, right, that we want to achieve to help alleviate poverty? And then what would be the outputs that would help get us to those outcomes? And what would be the inputs necessary to achieve those outcomes, right? So working backwards often helps. And then once you have your kind of theory, is to question every causal step, right? To see, okay, is it true that resources for immunization camps will keep camps reliably open? Maybe there's no corruption in this at the step. If camps are reliably open, doesn't necessarily mean parents will bring children to the camps. You're questioning every causal step. And then the thing is to have a focused suite of activities. So it's often the case, but not necessarily though, that it's a lot easier to do a couple of activities very well than to stretch yourself over multiple activities, right? So organizations that, for example, just do one thing, but do that one thing very well can be a lot more effective than those that do multiple things. Because as you kind of expand, often you'll need more resources. For example, researching new things you want to do, or gaining experience in new things you want to do. But if you keep affecting a focused suite of activities, sometimes it might be better. Explicitly naming the evidence or assumptions behind each step, right? So sometimes it can seem obvious, but it's really it's often things we take for granted and things we might be able to measure. Communicating the relative confidence issue. Once you have your assumptions, also useful to say, okay, how confident am I in this that this will happen? So we go to example, how confident that if I deliver lentils or cash transfers as an incentive to bring your child for immunization, that will help. Maybe I'll have high confidence here. But if camps are reliably open, I'm not so sure if parents will trust camps. I might have a lower level of confidence there because we have had camps open. So maybe that's not actually the issue. And the idea behind why you state explicitly a level of confidence is so you know what to measure, right? So for example, this year, again, why are we asking about breakout rooms a lot? Is because last year we didn't have breakout rooms. So we're very uncertain whether breakout rooms will actually be useful. We have a theory, but now we know we need to measure this. And we'll be asking questions related to breakout rooms as surveys go on. Then three, making it clear who the actor is in each step. Right now, to show an example of why this is so important, you see, you might make us to say, okay, parents bring children camps. Look at this one here. This is very clear about who, just and it's carefully chosen who is the actor here. It's not just saying children are brought to camps. It's saying being educated, parents bring children to camps. Because once you make it clear who the actor is in each step, it will bring new things to light. Okay, then we can, or maybe there's actually a problem where parents are too busy to bring their children to camps, right? They can't get a day off work, right? So once you know who the actor is, you also know where the intervention is to be made. And yeah, it's a lot more clear and a lot more robust. So when you're looking back, okay, why didn't something work? You know where to look. Some common mistakes, not making fundamental impact to goal, right? So I'm going to go back to hamper packing, for example. Hamper packing actually isn't necessarily bad, depending on what your goal is, delivering food hampers. Because often it like brings the community together. community gets excited. And if your goal is to build community around habit stacking, then it could be a very effective, right? But as long as you know that's your goal. But if, for example, your goal is poverty alleviation, last year, we probably have a talk this year as well on toxic charity. And a lot of the times, charity ends up creating more dependency. It doesn't necessarily empower people and uplift people out of poverty. And sometimes even things like unconditional lump sum cash transfers can be a lot more effective than first converting that cash into food and then delivering it. But this will depend on the context. The idea here is that understanding what you're actually solving for, and making that the goal, as opposed to trying to make an intermediary outcome more efficient, right? Not detailed enough, right? So say in an advocacy project, right? Often you'll have two major, in a theory of change might have two major things combined. They'll say, okay, policy is put through and implemented, right? So they'll say, okay, step one, advocate for a certain policy. Step two, policy is put through and implemented. But that's not actually detailed enough because those are actually separate steps, right? So you often want to break it up, make sure that you're not combining too many steps into once and you're not jumping the gun because they'll help in trying to identify problems or where interventions need to happen or what your challenges are. If it's very detailed and broken up a lot, you can really see, what assumptions you're making that might not hold. Because often, like, for example, in South Africa, like we have great policy. The issue in a set isn't always the policy. Sometimes it is, but sometimes it's implementation. So you can more accurately figure out where your intervention needs to happen. The third mistake is to set and forget. So theory of change is a theory, right? It's not validated necessarily. That comes from measurement. So it needs to be kind of a working document, continuously improved and tested. And the fourth mistake often is not building the theory of change into a measurement plan. So we have our theory, we have our assumptions, but just making sure that we actually are validating the assumptions, making sure that they do work.